Okay, so Jade and I will be talking about a group exercise program focused on preventing low back pain. We have been asked by our supervisor to develop a program targeting low back pain prevention. It will be a group exercise program that will take place 3 days per week for a total of 12 weeks, and each session will last 60 minutes. The main priority will be to increase the member's strength and stability of the core, lumbar spine, hips, and glutes, to prevent and reduce the low back pain experienced by the members and to improve their quality of life. Before any exercise program, the professional should consider side effects of common medications prescribed in this population. Common side effects of low back pain medications include dizziness, drowsiness, and some may affect hand-eye coordination, as well as the protein synthesis response post-exercise. A contraindication includes exercises requiring hip flexion, as the psoas major muscle originates on the lumbar region and will result in additional lumbar stress and pain. Avoiding heavy lifting and excessive spinal flexion within the program, as well as taking into consideration the common fears and anxiety with exercise that this population has.
Since the program is a group-based exercise program, marketing and incentivizing members to join will be essential for the continuation. We will advertise the program on social media sites like Facebook and Instagram. Flyers will be designed and distributed around the facility and at events within the community. Free daycare will be offered to parents who have children to encourage parents to take a break and better their well-being. Anyone who registers as a new member will receive a free t-shirt, and special discounts will be offered to those individuals who complete every session. And if a current member refers a friend who registers as a new member, both will receive a discount for the next month.
So in the next few slides, we will talk about the evidence that we found to support our exercise prescription, and we will discuss each article and the exercise that we chose to include in the program. So we decided to prescribe the dead bug hold as evidenced by Ibrahim et al. And Seleni et al. The exercise, when combined with other exercises, reduced low back pain and increased thoracic mobility. The exercise predominantly activates the anterior trunk muscles during bracing and some activation of the erector spinae. Ibrahim et al. Split 30 subjects presenting with low back pain into a control group and an experimental group, where the experimental group performed various core stabilization exercises, such as dead bug holds, side bridges, and supine bridges for a total of 8 weeks. Results indicated reductions in low back pain compared to the control group. In the study completed by Seleni et al., 102 college-age students were divided into 4 groups: an exercise group, electrical stimulation group, biofeedback group, or a control group. The intervention of the exercise group included static, dynamic, and functional exercises, of which included dead bug holds. Following the intervention, the exercise group saw the greatest increase in thoracic mobility, which may be a cause of low back pain. The next exercise, the bird dog, also requires clients to brace, but in a prone position, requiring activation of the anterior and posterior trunk musculature and activation of the external obliques. As evidenced by many studies, Seleni et al., Moon et al., and Sung et al., the exercise increased thoracic spine mobility and helped to reduce low back pain in patients. In the study by Moon et al., 21 patients with non-specific low back pain were divided into a lumbar stabilization group and a lumbar dynamic strengthening group. Lumbar stabilization exercises included single leg bird dogs, full bird dogs, and side bridges, while the lumbar strengthening completed supine bridges and prone hip extension, all of which were included in our exercise program. After completion of the 8-week intervention, both groups saw a decrease in low back pain. And additionally, Sung et al. Included 46 individuals with low back pain who either performed core stabilization exercises, including bird dogs, or spinal flexibility exercises. And after the intervention, the level of disability among those individuals in the core stability group significantly decreased compared to baseline.
As supported by Ebrahimi et al., Klazine et al., and Moon et al., supine glute bridges are used to treat low back pain. The exercise requires bracing as well as activation of the glute max and quadratus lumborum. In the study done by Klazine et al., an 8-month core stabilization program, which included supine glute bridges, was completed, and results indicated an increase in multifidus cross-sectional area. This muscle is important because it facilitates lumbar stabilization, and its dysfunction has been associated with low back pain. The side plank and prone hip extension exercises were used in the intervention of Akhtar et al. Study. There was a core stabilization group and a routine physical therapy group. The side plank requires bracing and activates the external obliques and was performed in the core stabilization group. The prone hip extension activates the gluteus maximus and was performed in the routine physical therapy group. Both groups showed significant reduction in low back pain after completion of the intervention. Similarly, reduction in low back pain was observed by Solani et al., Ebrahimi et al., and Moon et al., who also utilized either the side plank or the prone hip extension exercise.
Lehovsky and Paulson observed the effects of posture in 7 women during a 5-week exercise intervention. The intervention included strengthening and stretching exercises like wall angels. After the intervention, posture scores increased compared to baseline. Thus, wall angels may serve as an exercise to improve thoracic spine mobility and can be completed anywhere a wall is available. Also, all of the exercises that we decided to include in our program are able to be completed without excessive equipment. This allows members to perform the exercises at home as well as mastering the proper technique. Various muscles were targeted throughout our exercise selection, such as anterior truck muscles, the rectus abdominis and transverse abdominis, as well as the obliques and posterior musculature of the erector spinae, quadratus lumborum, multifidus, glutes, and hamstrings.
Our exercise prescription includes the variety of exercises that we represented and supported on the slides prior. The program is focused on developing the client's strength and stability of the core, lumbar spine, hips, and glutes. The sets and reps were determined from what was used within the studies and are in accordance with ACSM and NCSA recommendations. Utilizing these recommendations from various credible sources, we believe that all of the members who complete the entire program will experience significantly reduced low back pain levels and an improved quality of life.